Hey everyone, this is Tony Reeves. If you like my content or have any suggestions, please let me know, and by all means, make sure you share. The only way I can get my word out is you help me get the word out as well. Hey everyone, this is Tony Reeves, and this is Reeves Point of View. Today we're going to talk about what does post-COVID vaccine healthcare look like. Now, I know that was a long-winded response. You're like, what the heck are you talking about? What I'm talking about is a situation where now, as they are rolling out the vaccines, we're getting more manufacturers or pharmaceutical companies producing this. We're going to now find ourselves in this situation of saying, okay, ideally we want 70% of the country to be vaccinated in order to create this whole notion of herd immunity, which is the idea, and you probably heard over and over again about how you want a large percentage of the population to be vaccinated for particular reasons. But what you need to understand is the healthcare treatment that you received during the pandemic, in terms of the telemedicine, in terms of the frequency, in terms of various procedures. Be careful not to think in your mind the moment that we get this vaccine and everybody gets vaccinated, that we're going to go right back to the way it was before. Remember, the goal is 70%. I don't know how long it's going to take to get to 70%. You know, the reality is we may be at the end of the summer, it'll only be at 50%. And so that means you still need people who are going to be vaccinated, but you have to now take in consideration that there is a significant segment of the population who may be subjected or susceptible to getting the vaccine because they've elected to not get the vaccine. Why is that important for you to know? Because your healthcare provider has to take those things in consideration. They have to be mindful of the fact that a segment of their patients that they're dealing with is going to take the vaccine and a segment are going to choose not to. So I say that to say that their protocols may not change after the vaccine has been fully administered. So when you start finding yourself, and if you've got the vaccine, great. If you choose not to get the vaccine, that's your choice. Start getting into the position now of asking your provider, what is the protocol you're going to utilize once the vaccine kicks into place? Now, let me tell you another thing that you need to be aware of already. Don't be upset if your provider doesn't fully know, because it's still a work in progress. Remember, we just got through a year of the pandemic where there was no vaccine. This vaccine didn't start getting rolled out until December. So we're only about 2 months in. So keep in mind, they are still trying to work through the kinks of what is our world going to look like? And healthcare is one of them. So when you're talking to your provider, ask questions about what are you going to do after the vaccine? You know, are you going to go back to having everybody come in? Is it still going to be mostly telemedicine? Are you going to have staggered approaches? Are you going to go back to the way you were before? How often should I check in? Ask those questions ahead of time, because I want you to be aware. The new world order that we've been going through since 2020 may be the new normal. And you want to know how much of that normal is going to remain once the vaccine has been fully administered.